The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Excited to have a fellow marketer on the program today. I'm going to jump right in and give an introduction, and then we'll talk about why we have fellow quote competition on the program, and then we'll get going. Lane Rizzardini, say hello to everyone.
Hey, thank you for having me.
It's great to have you here. Your website, sleepapnealeads.com. I think it pretty much tells everybody what you do and what you specialize in. Sleep apnea leads. Is that a good guess?
Yes, we help dentists get more sleep patients.
Yeah. And so let me just real quickly talk about something. And I think this is important for all of our listeners to hear. We've had multiple marketing companies that come on our program. Everybody knows that we're a marketing agency ourselves. And I've had people say, why would you do that? Why would you ever have your competition on the program? And it's simple, 2 reasons. One, some people are experts in one specific thing like you are in sleep apnea leads. There's a big advantage to our clients and our listeners on this program hearing about that and hearing about what you do. Huge, huge advantage there. And then the other thing is too, is very much we have an abundance mindset. This is what this program is about. This is about like sharing, everybody getting better. For the most part, there is more than enough to go around. If you're trying to better your practice and earn more money, I want you to know that there is so much money out there right now. You don't need to make money. You just need to earn what's already there waiting for you. So very much an abundance mindset. Lane, I'm assuming you have that same abundance mindset.
I love that term of abundance mindset. Yeah, we think that the pie is finite, and no, we can grow the pie, at least in America.
Sure.
And then, like you said, everyone has different strengths and weaknesses. And I would say, well, we've invested a lot in dental sleep medicine. We don't have that for dental just on its own. And so it depends on what your goals are for your practice or who you'd want to choose.
Awesome. Well, let's rock it. Sleep marketing, right? Sleep apnea marketing. I think this is an area that a lot of practices just simply fail in. They go to take some CE, they get some kind of interest in it. They see it as profitable. Oftentimes from the companies that are selling the devices, they're saying, oh, you can make a fortune. Or companies that help you with sleep studies, we can make a fortune, or the at-home sleep studies, you can make a fortune. And so dentists jump into it, right? Because they're like, I'm interested in it. It does help people and I can profit from this. But then that never really comes to fruition. And I believe that doesn't come to fruition because there's not enough efforts going into it. It's kind of like, hey, we got our toe dipped in here and they're not really kind of jumping fully in the pool. What do you see there, Lane? What do you see as big failures and what causes people to fail in their sleep apnea programs and their practices?
I agree that you go to a conference, you get some CE, someone on stage is talking about how easy it is to get physicians to refer you patients and just how much money they've made and all that. And then you go and you don't realize like, oh, there's a lot of work here if I want to do this, and how different it is from dentistry just in the, just the fact that it's medical and not dental, really. It's a whole different set of insurance. And it really is, from a marketing perspective, a entirely different patient entirely. And so that's something that we talk about a lot, where our strategy really involves around, like, we don't even market sleep apnea to dentists on their dental website. The problem is that you can run all the advertising you want. If a patient goes to a dentist website, and a lot of you have like one page in your site about sleep apnea, buried in your pages about cosmetic dentistry, all on four, like all of this stuff. And they're kind of like, well, I don't have a dental problem. I have a sleep problem. The physicians you want to refer you patients are like, well, no, this guy probably doesn't take my patient's insurance. They're probably not in the AADSM. So I'm just going to go and find an expert. And so our strategy really revolves around like needing to build a separate branded entity that really showcases all of your expertise and commitment really to the sleep space. And then really from there, like, breaks down the patient journey, right? It's just very different from a dentist where like you're probably looking for someone close to your office that's affordable, that has the treatments that you need. Those are kind of your check marks. With sleep, it's, a patient that is looking for a CPAP alternative needs very different information than a patient that doesn't know if they have sleep apnea yet, and frankly doesn't know how much of their life it's taking away from them. They receive very different information. And so you need different pages that communicate to those patients, which then you can use for all your different advertising means. When you're running Google ads, your keywords are going to resonate with different people that are typing in CPAP alternatives versus testing. But then the big challenge that we saw with sleep that was like entirely different from dental is, it's one thing to get a lead, right? Getting leads was never that hard. It was the getting patients to get into the office in the chair. That was really the hard part. And the reason is that this, dentistry is, people go to the dentist, hopefully. But it's kind of like your tooth's in pain, you crack your tooth, it hurts, you go in, right? If your teeth are yellow, you want to get that taken care of. You feel like there's a stigma with that. You want to get it done. Sleep is kind of this weird thing where people don't really want the treatment, nor do they think they really need it. They think they can handle it with like melatonin or a Z-Quiet or something easy. And so they're trying to look for like any excuse to like bail out of the process. They think they're going to need a CPAP. They think they're going to need an in-lab study. That's like thousands of dollars. And so your marketing just needs to do a much better job of communicating that, hey, this is dangerous, it's something that you need to do something about. But then also as a dentist, like you have way more convenient options for treatment. Like it's quiet, it's travel friendly, and then you can get tested at home. Like there's all these great benefits that need to be communicated clearly on your website. But then from there, like it's still a $4,000 treatment. Like these things, people don't make these decisions in one call. You have to do follow-up. And so one big thing that we implemented that's really changed everything for us was what we call our patient conversion system that does automated, well, initially when we started it, it was automated text messaging and emails that would follow up with patients right away. As soon as they answer, they placed a form submission, and then it would do a long-term follow-up based on what the office said happened on the call. Maybe they're just interested. They have to convince their husband to do the treatment. Great, we'll follow up in 14 days. Now we've developed an AI agent that does that via text messaging and just text messages the patient, has a conversation with them, gets their insurance information, answers their questions, and then moves into a call with your office. That's like probably the biggest challenge that we had to overcome that was different from dental and that made sleep like very unique and is just a big challenge for that the dentists don't really know is coming. And with that, like they don't know how to train their staff to like have the conversations about it. There's just that whole side of like the conversion side of it is really the hard part, which makes your conversations with their dental agents, with their marketing agency really hard because your marketing agency's like, look at all these leads we got you. And then you're like, but no one's gotten in the chair. And your marketing agency's like, but we did our job. You need to do your job now. And then, but like nobody wins that way. Right. And so that's why we felt like we needed to go to the next step if we were going to be successful and to help our clients be successful.
Yeah. That makes a ton of sense to me. What is some of the, as far as using AI chatbots for text, what are some of the, and now voice, right? What is some of the pushback? What are some of the, like, what are dentists saying when they're, that are not for it? And then what's the answer to that?
Yeah. So I'd say the number one pushback that we get is that they think when I say AI agent, they think it's a chat box on their website. And that like, it's like a choose your own adventure. Sure. You know what I'm talking about? Where like you say, again, it's like, hey, which thing would you like to hear about? And then it'll start talking to you. And it's like, yeah, that is lame. But it's not that, right? And so we have to show them. So we have a place on our website where it's like, hey, go to our website. It says, meet Sarah. And you can fill out a form and like, just try it. And they find out very quickly that like ours is, the way to do this is different in the sense that like, it's just texting you. Like in the place that you text all your friends.
Right.
And it's completely conversational, just like you're talking to a human.
Sure.
It's not trying to push you down a different path or like give you no, like you just like ask it whatever you want. It tells you whatever you want. You can pick up the conversation whenever you want. It's not in this other thing you don't have. It feels very natural. And so it feels like a human is talking to you. And we've had stories of like patients wanting to hire Sarah for like their roofing company or something because they think it's like a VA and they have to like explain, no, that it's AI. That's been fun. And then And so we know this works. It's like conversion rates are 8 times higher if you respond in the first 5 minutes.
Right.
And like your staff can't do that, right? It's impossible. And so having this very like human feeling thing like gets these leads to like not go like move on to the next office because they already feel like they've gotten a response from you, and a response in a way that is how patients want to interact with, really customers broadly want to interact with businesses now, which is like via text message. Text message has like 95% open rates relative to email, which is like 20%.
Right.
Everything just gets caught in spam filters now. And so texting is really the way to go with any sort of follow-up system you're building to really make this feel more natural and good. And you touched on voice, like that's the next. I've seen mixed results on voice. We haven't quite gotten there yet because it like sometimes sounds really rough, but in 6 months, voice may just be off the charts good.
So let me ask you this question, and this is one that I think about often, because obviously it is very clear that most practices have a difficult time even answering their phones. I know a lot of dentists think their team is doing a great job answering their phones, and then when you actually track them for a month, you see that maybe 50% of them aren't being answered or more, and so it's a huge problem. And obviously, right now, if someone calls your practice lunchtime, you don't answer, they're probably going to call the next dentist and then the next one and then the next one, right? They're busy. They got a half an hour. They don't want to leave voicemails and have people calling back in the middle of the day and play phone tag. So that scenario happens. So there's a big advantage if you answer the telephone. Now, if you have an AI chat, whether that's texting, which is great, or when it goes to voice, and that's really reliable, and everybody has it, that advantage is going to be lost, right? It's going to be back to a even playing field when every practice has this, is it not?
Yeah, that's a good point. I think at some point these stakes will be raised, right? So like right now there's the expectation, I think it's like 73% of consumers expect a response to a sales question in like the first, and like within an hour or something like that.
Yeah.
And it's like, it's probably just going to be in 15 minutes. I think the stakes will continue to get raised.
Yeah.
But I also wonder, like, we're on the forefront of this. Like, we know this is happening, but kind of in the abundance mindset aspect of this, like, how many dentists like still have a website that looks like it was from the 1990?
Sure. Yeah.
Right. I think there's going to be I think if you get on this now, it is going to help you're going to be way ahead of the game for a vast number of years relative to a lot of the competition.
If you can fill your practice, let's outside of sleep, let's just say like in general dentistry, if you can fill your practice now, you're going to be ahead of everyone else. Their AI is not going to do a great job of ripping your patients away as long as you're taking great care of them. So that makes total sense. Lane, on your website, bottom of your website, there are some cool things that people can check out, some resources. I think people should jump on and play around with Sarah. Take a look at it, her, if you want to call it her, I'm going to call it, and play around with it. It's amazing what it'll do, but you've got a nice sleep website checklist on their marketing health analysis. So if you're looking to really significantly increase the amount of sleep apnea patients that you're bringing in, and by the way, I know this, Lane, you know this, practice owners that have had a great deal of success in sleep know the more you bring them in, the bigger your margins get. Your team gets tuned in, costs go down, it becomes way more profitable and a lot more fun seeing 10 patients per month than seeing one patient every other month or one a month. So Lane, I want to thank you for being here at sleepapnealeads.com. Lane, again, appreciate your time. Thanks for being here.
Patrick, thank you for having me.